Sperm count, motility, morphology, DNA integrity, which parameter is the best when it comes to fertility? What should be the best optimum?
Nadiya, should I tell you an honest answer? None.
So let's welcome Dr. Fahim to the show.
Hi Bengaluru, Namaskara. I'm Dr. Fahim. I'm a urologist and andrologist.
Because we have a lot of men who are watching this podcast and they're really interested in knowing a lot of answers, and there are a lot of times they feel embarrassed to go meet the doctors or talk about these issues openly.
As I was always, during my study days, I was always wondering why only women and child health was focused. Why never men's health was focused? In terms of, let's say, a man will always be focused on earning, providing for the family, getting the sons and the daughters married, sitting at the last chair of the reception hall, and then going to an ICU with a heartache or a heart attack, and taking care of men in terms of overall vascular and metabolic health. So Nadiya, I'll be, I guess, helping you as well as answering the questions, as well as helping the audience, especially men who are suffering from infertility, sexual dysfunction.
One thing what we notice is men are opening up. They're coming for the test themselves, they're getting evaluated, so that is really welcoming. But apart from that, what kind of cases are you handling?
A man and a woman gets married, and if they are trying to have a baby and they are not able to have so, the family will always first blame the women.
Correct.
That there might be some problem with her. Go to a gynecologist and get yourself evaluated. So the gynecologist was always the first point of contact for the couple.
So apart from semen analysis, what are the baseline tests would you recommend for couple when they are facing infertility?
Okay. The most easiest cornerstone evaluation of male infertility.
Those people who've not done their semen analysis, is it required that if some conditions like this are persistent in the body, that might have an impact on their sperm health also?
Let me go through in a very simple way.
Welcome to the Fertility podcast. In today's episode, we are talking a topic which is very important and serious. And to talk about that topic, we have the master in its own craft, Dr. Fahim. So we are talking today about male infertility, and Dr. Fahim is an expert specialist in treating male infertility conditions. He is a urologist, andrologist, and a reconstructive surgeon. So let's welcome Dr. Fahim to the show.
Hi Bengaluru, Namaskara. I'm Dr. Fahim. I'm a urologist and andrologist. In brief, it's been an amazing 10 years journey in Bangalore itself, and I have done my urology and andrology training, the first fellowship in Bangalore itself. That's when I fell in love with this city and the people, as of course. And then I did my advanced fellowship training in the University of Miami, Florida, and then I did some training in Brazil as well, and then I'm back to Bangalore serving people.
Thank you so much, sir. So glad to have you here, and we are so excited to know what you have to share, because we have a lot of men who are watching this podcast and they're really interested in knowing a lot of answers, and there are a lot of times they feel embarrassed to go meet the doctors or talk about these issues openly. I think this forum is an open discussion, and we will talk a lot of things which will definitely help them in their fertility journey.
Thank you, Nadiya, for and Fitly to inviting me to this amazing podcast. As I was always, during my study days, I was always wondering why only women and child health was focused. Why never men's health was focused? In terms of, let's say, a man will always be focused on earning, providing for the family, getting the sons and the daughters married, sitting at the last chair of the reception hall, and then going to an ICU with a heartache or a heart attack,
Right.
pouring all the saved money to the hospital, and then coming back home as a regretful person, why I have not taken care of me during my youth days, during my family days, during my earning days. That's how the men's health and taking care of men in terms of overall vascular and metabolic health became my point of interest in studies, and the urology and the andrology as field gave me the platform to do it.
Right.
So I guess I'll be able to help to solve. So Nadiya, I'll be, I guess, helping you as well as answering the questions, as well as helping the audience, especially men who are suffering from infertility, sexual dysfunction, and able to guide them how to start a stepping stone towards their health.
Right, thank you, sir. Actually, what you told was very relatable because we have seen this in the past, right? A lot of men always end up being in the hospital after a certain period of time when they are retired. That is when they want to enjoy, but that is when their health issues take up because they have not taken care of their health from a really long time. And seeing our parents, like our fathers or our husbands or our brothers going through that is really heartbreaking for anybody in the family. So I think this is a great awareness show, and we would love to hear your comments. So let's get started directly.
Let's do it. Shoot.
Yes. Okay. So first question, sir. So now when we are talking about fertility, what kind of cases are you seeing recently compared to many years ago? One thing what we notice is men are opening up. They're coming for the test themselves. They're getting evaluated. So that is really welcoming. But apart from that, what kind of cases are you handling mostly, and can you tell me?
So let's go back 10 years, and I will just start transiting 10 years ahead as well. Before, let's say a couple, a man and a woman gets married, and if they are trying to have a baby and they are not able to have so, the family will always first blame the women.
Correct.
That there might be some problem with her. Go to a gynecologist and get yourself evaluated. So the gynecologist was always the first point of contact for the couple. Over a period of years, where gynecologists themselves started to seeing that there is no female factor as such in terms of that couple. So gynecologist was the first point of contact for such couples. And on evaluation, most of the women were considered to be normal in terms of fertility evaluation. And when they went to the other side of the story, as in they started doing a male factor evaluation, a basic, let's say a semen analysis, they themselves did not know how and whom to refer. And in such cases, the couple will struggle to have a self cycle. Right. In terms of natural pregnancy, in terms of, let's say, an ART, because ART also developed during that time, but there were difficulties in managing complex male factors. So donor sperm was an option during those days. Now science progressed, the internet progressed, the people progressed. So we over a period of time, studies have shown that 1 in 6 couples are infertile, of which 49% are related to male factor infertility. So now people are Googling, and they might be using ChatGPT to the best of abilities and getting to know that yes, definitely there is a male factor infertility which needs to be addressed, optimized, and get a baby of their own DNA. So over a period of time, I as an andrologist, I am getting most of the referrals still from the gynecologist community themselves to optimize the male factor for whatever reason. It can be for natural pregnancy, for an assisted reproductive technique, let's say an IUI and an IVF, so that we as a clinician will be able to give a couple your own DNA baby.
Okay.
That's the aims and objectives.
Okay. Okay. So apart from semen analysis, what are the baseline tests would you recommend for couple when they are facing infertility?
Okay. So regarding semen analysis, let's start with semen analysis. Semen analysis is the most easiest cornerstone evaluation of male infertility, which I guess a patient can do it himself.
Okay.
If he knows he wants to get a fertility check by himself, or the most preliminary examination or evaluation which is done by the gynecologist themselves. Okay, because it is easily done, available, kind of standardized as per the WHO 6th edition which we are using right now. Which this semen analysis, no Nadiya, gives an approximately idea about what is the count of the sperms, what is the motility of the sperms, and what is the morphology, how the sperms looks, the head, body and tail. Okay, but apart from giving let's say a demographic data of the sperms, it doesn't label a male as fertile or infertile.
Okay.
The reason being, semen analysis always has to be a part of evaluation and not the only part of evaluation. So let's say I am unmarried and I am going to get a fertility check done before my marriage, and I have some issues in my semen analysis. Doesn't label me completely fertile or completely infertile, because my fertility scoring always depend upon my 50% of the shareholder, who is a female.
You're right.
You understand? So a sperm and an egg will make an embryo. So always the fertility scoring should be taken care of the couple itself, not of the individual, because there can be a normal male factor and abnormal female factor, abnormal female factor and a normal female factor. Both are abnormal. Both can be normal and there will be an explained infertility. So we have to come to a common ground how to get the couple a baby through various routes by understanding where exactly is the problem and start creating solutions for the couple. Number one. Number two is, let's say I'm a urologist as well. Let's say you get a kidney stone. So I'm a urologist, I might write a ultrasound of the kidney or a CT scan of the kidney to know how many stones, what position, does the kidney swelled up, does require surgery, can we do a shockwave treatment for the stone. Apart from that, I'll do a renal function test, let's say urea and creatinine and a CBC to see infection is there, kidneys are functioning properly or not. So there are something called as testicular function test as well, where kidneys has two function, a testosterone production which is required for a daily quality of life as well as daily metabolic activity, and a sperm production. So I will be taking a detailed clinical history in terms of his whole sexual cycle, in his whole where desire, libido, erections, ejaculation, orgasms will be taken care. Number two, a semen analysis and an examination of the testes. So these three forms a three major part of the puzzle where I will be able to conclude a man towards having more probability towards fertility or significant infertility, so that I will be able to tell the patient that I am going to expect any bankruptcy in your sperm analysis. Number one, should I do any important steps so that I can preserve his fertility, let's say for example freezing. And number three, optimize the sperm to the maximum potential so that I will be giving the pregnancy in terms of natural pregnancy, IUR and IVF depending upon the couple parameters. So semen analysis definitely is important, but it is not only the test to label a man fertile or infertile.
Okay.
Except in 3 conditions, I guess we will be discussing in future.
Okay, and we also see some clients who come to us, they have issues like fatty liver, they have insulin resistance, and those people who have not done their semen analysis, is it required that if some conditions like this are persistent in the body, that might have an impact on their sperm health also?
Okay, so simple terms, let me go through in a very simple way. Testes. We are social animals. The nature has made us one of the predominant race on this earth, and it has made sure by us procreating on this earth. So for procreation, as I told, sperm from the testes and oocyte from the ovaries are required. So whenever testes is formed, it is formed inside the abdomen, and over a period of 6 to 9 months they get traveled down and they settle in the ball sac, basically the scrotum. The testes are so protected down there that even the metabolic processes of the whole body versus the testes is absolutely different.
Okay.
Let me tell you a fact which I guess most of the people don't know. Even a person who is suffering from an HIV virus, the sperm doesn't have an HIV virus.
Okay.
But the fluid will be having the virus.
Okay.
So there is a possibility that I can separate the sperm from the fluid which it is floating inside, or the seminal fluid, and I might be able to reduce the chances of transmitting the HIV to the baby if the male factor is positive.
Okay.
So that well protected is the sperm. Okay, so let's say if a body is insulted in terms of metabolic abnormalities, let's say diabetes, hypertension, dyslipidemia as in abnormal lipids, lifestyle traumas which we are giving right now in this century, which we are dealing with in terms of junk food, excessive fatty foods, sedentary lifestyle, smoking, alcohol, and an amazing amount of recreational drugs because of its availability and fun. So these definitely will impact a sperm which is present in the testes, which is already trying to protect it to its maximum core. So overall, if the body is getting affected, a sperm which is a very sensitive gamete definitely gets affected. So yes, this needs to be taken care so that I'll be able to optimize the sperm. So that's the one of the major cornerstone of treatment as well. Treat the vascular, hormonal, metabolic health, automatically a qualitative improvement will definitely be seen in the sperms.
Okay, sir. How about sperm DNA fragmentation? So even the gynecologist, when we spoke to her last time, she told it's a really important test to be done. So from your perspective, how important it is and what does it indicate, the results?
Okay, as I told, nature's concept is best sperm, best egg, best embryo, best pregnancy and baby on table. So we as clinicians, I as a clinician will always be interested baby on table. A pregnancy can happen, embryo even can be formed, implantation can happen, the pregnancy goes into abortion. Why? Because rule number 1, God doesn't want to give abnormal baby to anyone. Okay? So let's say if there is any qualitative issues in a sperm, definitely the software of the embryo which is generated, which is abnormal, and as I told you, nature doesn't want an abnormal offspring to come, it results into abortion. So abortion becomes a protective mechanism rather than the couple going into a depressive phase that, oh, we are getting abortions. It means that the nature doesn't want to give them an abnormal baby so that they don't suffer in a long term to take care of something which they actually did not intend to. Best example I can give you is a COVID. When the first wave hit the whole world, people when the software of COVID started downloading in our system, people who were not compatible, they just vanished.
Right.
Why they vanished? Because they were not, the DNA or the software which they were generated was not compatible with the change, and such change not cut for, and not to have this kind of a situation where mankind has to survive through lots of epidemiological trauma which is going to happen in future. The DNA of this sperm is one of the most integral part to be optimized before any kind of treatment, let's say natural pregnancy or an ART, IUI or an IVF. So yes, definitely DNA fragmentation is one of the most important parameters to be optimized, but not the only parameters which we need to focus.
Yeah. So, sir, among count, motility, morphology, DNA integrity, which parameter is the best when it comes to fertility? What should be the best optimum?
Nadiya, should I tell you an honest answer? None.
Oh, okay.
Okay. Now, why I will justify the answer as well. Except a person who is azoospermia, as in there is no sperm, cryptozoospermia, where there are only few selected sperms, and recurrent implantation failures, recurrent IUI or IVF failures, and abortions, recurrent abortions. These are the factors where male factor is considered to be very significant in terms of, I will be considering the count, morphology, motility, the DNA integrity as well. But as I told you, fertility scoring is always about the couple.
Okay.
Let's say, even if as compared to nature balances, that's why there is a balance between an egg and a sperm. As compared to a sperm and an egg, the egg is slightly strong as a gamete. So the egg has a capacity to take even a weak sperm, repair and make a baby. Even it is shown that early embryos which are formed has a capacity to repair itself and make a baby.
Okay.
So as I told you, I will not label based on count, motility, normal forms. Immediately based on those criteria, a man fertile or infertile. Definitely, as I told you, DNA integrity is one of the integral part. Now, how DNA integrity has come is, now because over the last 10 years, rampant ARTs, let's say IUI and IVFs are happening. And because of lots of IUIs and IVFs are happening, where sperm factor was not optimized, lots of abortions and implantation failures are also happening. And the cycles are failing. So retrospectively, and the clinician started to recognize where exactly is the problem. And that's how the DNA fragmentation index came into a picture, where they got to know, let's say, the sperm might be looking absolutely okay under a microscope with a head, body and tail. But what is going on inside, no one knows.
Okay.
So an androtechnician will be able to tell you the count, morphology, the motility. The inside DNA quality of this sperm, which the sperm is going to contribute to that embryo, no one tells. Over a period of time, with recurrent of rampant ARTs and recurrent failures in abortion which are happening, DNA test as in DNA fragmentation index, as in the percentage of DNA which is broken inside the sperm, test started coming into picture.
Okay.
And then to optimize that, studies have shown that if we start optimizing the DNA fragmentation index, automatically the chances, let's say a natural pregnancy or an IUI or an IVF or an ICSI, improves drastically.
Okay.
So that is the concept of DNA integrity.
So, is it possible for sperm to look normal in the reports but yet be biologically weaker according to you?
Okay. Now I'll give you a scenario. Let's say you, me are waiting in the airport lounge, flying to Delhi today. After looking at you, I will not see any abnormality. After you see me, I will not be looking at any kind of abnormality with me. The same thing is with a semen analysis.
Okay.
When an androtechnician sees the sperm under the microscope, the sperm will be seen physically. not electronically. Okay, so let's say a person who is walking in front of me, I don't know that person is suffering from diabetes or hypertension unless the patient is showing me some physical signs. Let's say there is an ulcer on the foot, or let's say he's having he is having a blindness and he says that he is diabetic, or he is in the hospital where I will be taking history, then only I will know that this person is suffering from diabetes or hypertension. Otherwise, outside the person might be looking fine unless there is a physical abnormality which is present, which is very evident to that disease. The same thing is with the semen analysis as well. The sperm head, body, tail will be seen, but inside how the DNA is good in terms of its, there are two types of DNA a sperm has, a mitochondrial DNA and a nuclear DNA, which is going to get contribute to the baby or the embryo itself. So what breakage of the DNA is the sperm is having should be done by advanced tests, let's say a DFI test, DNA fragmentation index, where there are various methods which are used. There are some are standardized, some are non-standardized, number one. Number two is the sperm layer integrity, as in the skin, how our skin works. The skin is one of a protective layer for our body, so that whatever insult is happening, let's say an environmental insult is happening, it protects it. The same thing is with the sperm skin as well, as in the sperm membrane as well. If it is very much integrated or very much smooth, the chances of the DNA stored inside is well protected. So there are various tests which are upcoming right now, which I am doing at my center in Bangalore at Ankur, where we will be able to know how much breakage of the sperm wall is it.
Okay.
Because if a sperm is looking okay, I cannot send a crooked or a, let's say a handicapped sperm to play an Olympic. So if the sperm doesn't have a very amazing integral membrane and a optimum quality of DNA, the sperm doesn't have a capacity to survive inside the female genital tract, inside the uterus basically, and knock the door of the egg and enter. Also, one important protection mechanism I wanted to mention here is, sperm has a capacity, something called as abortive apoptosis. Apoptosis means whenever any part of the cell is trying to get abnormal, a body tries to protect it from that cell by making that cell to die.
Okay.
So the cell dies, so it's like it's a dirty cell, it just goes off. Okay, so that's the process called as apoptosis. Now sperm, whenever a sperm is getting generated in a testis, and if there is, let's say, some kind of DNA damage which has happened, the sperm does it still grows despite having that DNA damage. And these sperms will be having a head, body, tail with a damaged DNA, and they will be coming outside into the ejaculate, and these sperms even have the capacity to fertilize the egg. You understand? So what happens is, at the end, this damaged sperm is fertilizing the egg, the embryo gets formed, the embryo is abnormal, and that might result in recurrent abortions. And thus apoptosis has to be taken care so that our outcomes for having a baby improves.
Okay.
So yes, definitely your question is very authentic in terms of we just don't see the sperm physically outside. We need to go in deep, dig in deep, optimize it inside so that automatically outside it glows.
Right.
So that we get our outcomes.
Right, got it. Sir, so recently we see a lot of clients like this, like they are working out aggressively in the gym with a six-pack, like even college-going men. But we've also seen some of them have poor sperm health as well. So should they be really fit to avoid this, or being fit doesn't matter, or how does this work?
Okay, let's put it this way. Let's compare Bangladesh currency, Indian rupee and a US dollar.
Okay.
Okay, all three are currencies, notes, but are they equal? No.
Right.
So we men as well as females as well are born with a set of stem cells which I call them as gold reserves.
Okay.
Okay, so how much the gold reserves a man has, he will be printing notes against that gold reserves, against the stem cells. So there might be an amazing body physique, a guy who might be looking like, let's say, Hrithik Roshan as well, might be having zero sperms in his testes, in his ejaculate basically. It all depends upon what kind of genetic, hormonal and epigenetic changes which he had as an embryo when he was there. That gives him what will be the bank balance of the stem cells in the testes. So definitely an amazing body is not equal to amazing sperms.
Okay.
But definitely to have a definite sperms quality, you need to approach towards an amazing body,
Right.
because that will improve quality of the sperm. Quantity of the sperm to improve or not, it all depends upon how much stem cells is having. It's not like that I will be giving you a tablet and an injection and how money pressing machines just prints notes, the sperm prints out into the system. No, it doesn't work like that. The tablets or the mechanics or the hormonal injections, if required, will work only if stem cells are there inside the system to stimulate and then get it out.
Okay.
So that is the major fallacy, or let's say doubts within the patients and let's say some clinicians as well, that I give the tablet, I give the hormonal injections and the sperm starts getting producing. It doesn't work like that. Only let's say a guy who is going to the gym taking anabolic steroids in terms of exogenous testosterone, or let's say lot of bodybuilding steroids as in, such patients, if we start back to get their system back into track by giving hormonal injections, they start throwing sperms back into their ejaculate.
Okay.
This is the only scenario where hormones works. There might be some scenarios where we will be giving our patients hormonal therapy for sperm retrievals, just to make sure our retrieval rates becomes high, so that whenever we are going for a procedure, or let's say whenever I am going to retrieve a sperm for such patients, the chances of getting sperms is high, and I will be using that for an ART, let's say an ICSI for that matter.
Okay, but if somebody is like overtraining, right, that has an effect on their testosterone, apart if they're not taking steroids, but they're just overtraining.
Now, doing workout in general, let's say at least 2 to 3 hours in a week, is statistically shown to reduce cardiovascular heart disease, stroke risk, the overall aging process by around, let's say around 20 to 30%. Okay, so automatically the body inflammatory markers comes down, the metabolic health becomes good, the vascular health becomes amazing, the blood flow to the testes improves, automatically the sperm count improves, as in the sperm parameters improves. So yes, definitely doing a workout as well as having an amazing lifestyle in terms of, let's say, a Mediterranean lifestyle, less in junk food, no smoking, no alcohol or limited alcohol, or absolute restriction of recreational drugs will definitely improve sperm quality. Now regarding testosterone, it has been shown that workout does increase the level of testosterone in the body, but not to an amazing significant level. But yes, it does increase. Automatically, if the testosterone increase, which improves the quality of the muscle itself, it will improve the quality of the sperms as well.
Okay, now as we're talking about lifestyle, how is chronic stress affecting the sperm quality?
Okay, now I will say two types of stress. Let's say a physical stress and a mental stress. Now everyone on this earth is having mental stress. Mental stress There is no major landmark study which has shown that mental stress is causing infertility.
Okay.
If that would have been the case, I guess uh, the most stressed people on earth, as you know,
Doctors.
how the things are. Let's say professionally, yes, doctors themselves, politicians will be absolutely infertile.
Right.
The way the mental stress shoots up, especially for politicians. So physical stress, definitely. Physical stress can be one of the physical stress is an oxidative stress, which is related to the food, which is related to the aging. Let's say I might be 40 years on Aadhaar card, but when I really check my age, I might be 60 years. That's my physiological age. If there is a major disparity in between that, I might be on passport 40, but when I see my sperm health or overall health of my body, it is 60 years. So I will be having problems of 60 years old despite I am writing a 40-year-old male. So that disparity, if I try to come to a common ground and start reducing it, automatically the overall parameters include not only sperm, the heart health, the brain health, the kidneys, the liver, everything. So that's the concept how it works.
Okay, but in today's generation, do you think the levels of oxidative stress are quite higher compared to how it was before?
Okay, so when we try to check for stress, there's something, as I told you, the lifestyle, the environmental, the exposure factors which I have told you, these definitely affect the sperm to an extent. Smoking. Smoking will break the DNA, cause DNA fragmentation by 20 to 30%. Alcohol, what it does is, it tries to make the man more towards female, as in the testosterone and the estrogen, which we both require, is in a balanced ratio. Let's say 10 cars of testosterone to 1 car of estrogen. Alcohol reverses that, and that causes lot of fat accumulation. The muscles starts becoming weak, the sexual drive starts becoming weak, the erection quality starts becoming poor. He might be able to have and achieve an erection, but maintenance becomes a problem. The ejaculate volume starts becoming low. Prolactin as an hormone starts uprising. Automatically his desire to participate in sexual activity starts going down. So overall, a man quality of life gets affected because of stress. There are some correctable factors which we see which will cause stress to the sperm, as in when I pull down the pants and palpate the testes. So there is an artery which gives amazing oxygen to the testes, and there are veins which carry all the toxins from the testes to the system and gets excreted out of the body. So there are some called as dilatation of these toxin carrying veins from the testes towards the kidneys becomes big, and that is called as varicocele. Most of the people are born with it. It is not necessary that varicocele will be causing infertility in all of the case, but yes, a person who is having a varicocele and having an infertility problem after trying at least 1 year of continuous consummation of marriage, definitely varicocele is the cause of infertility, which will cause oxidative stress as well to the sperms, the DNA breakage, and once I repair that, automatically it starts reducing the oxidative stress to the sperms, and we will be able to get the baby for the couple.
Okay.
So yes, oxidative stress, it is multimodal. It can be physical, it can be bio-environmental, it can be examination finding in terms of varicocele. All the 365-degree angle of stress has to be taken. But if you say mental stress is causing it, mental stress will only cause participation of that man performing a sexual activity, or if he is able to perform but not able to penetrate will be the cause. Rest, it doesn't have any major effects on sperm. There is no statistical data on it.
Okay. So, sir, like there are a lot of symptoms for many diseases, right? So, similarly, are there any symptoms if somebody is having a poor sperm health? Can we identify that? Like, because people ask, how can I identify without even going to the doctor that my sperm health is low?
Okay. So, there are few causes which have been determined by science till date. Let's say I'll be talking about some extreme where patient comes with a zero sperm, only liquid, no sperms, where there might be some genetic abnormalities. Let's say a Klinefelter syndrome, where a person, let's say man is coded by an XY software or a genetic makeup, and a female by an XX. If there is an extra X into a man's system, is called as a Klinefelter syndrome. So it's a spectrum of a disease. So in that Klinefelter syndrome, most of the patients come with a zero sperm, and only the sperm retrieval rate is only by a surgery, where I'll cut open the testes, use a microscope, see where the sperm production is happening and pick up those sperms. It is, the sperm chances retrieval is less than 4% in such patients. Number 2 is, there is something called as, I told you now, we are XY. If there is a problem, we are special, we are blessed with a Y chromosome. Any abnormality in that Y chromosome will result in azoospermia, as in no sperms. Now, as one more factor which is upcoming right now is epigenetic changes. So let's say today we are wearing clothes. Why we are wearing a clothes? Because we want to protect our body through sunlight, for example. And let's say if I'm wearing a half sleeve shirt, I will have burns on my half of my forearm and the arm, correct? Same thing is an epigenetic changes. The epigenetics are the molecules which will protect the DNA of the whole system basically. Now if there is any change which happens in the epigenetics, the DNA gets exposed. That exposed DNA gets damaged. The outcome can be in various forms. That includes infertility as well.
Okay.
And that might result in absolute production defect as well, where a person is producing sperms but not to an extent where it is able to fertilize a embryo. Okay. So yes, definitely genetics is one of the reason. Number 2 is hormones. Hormones, as I told you, testosterone hormones from the testes itself, and there are 2 major hormones, as in the FSH and the LH, which is released from the pituitary of the brain, where it goes and tells the testes to produce sperms. If there is a disparity between the brain and, as in the son and let's say cut, if there is a disparity between the father and the son, automatically the outcomes also becomes abnormal. So if there is a rising FSH and LH, it means the testes are not listening to the brain to produce sperms. It means stem cells are not there. There is a production defect. Or let's say there is no signaling from the brain itself, no FSH and LH, but the testes are ready to work. These people will do amazingly once I start giving them FSH and LH. They will start producing sperms. So that's how we have to recognize what parameters where we have to hit so that the patients start having optimal sperm outcomes.
Okay, so is low libido a clue if people are having poor sperm health?
So infertility per se doesn't have any symptoms. Okay. Men will not come with a symptom of infertility. As I told, outside they will be looking absolutely normal to me, unless they are super obese, their BMI is very high, their waist circumference is high. So I will be seeing, okay, I might guess there might be a testosterone estradiol ratio abnormality. Apart from that, history taking is most important. Before checking, doing a physical examination, he will, once I ask him question about his whole cycle, where desire, libido, his erection grade, his ejaculate volume, his orgasm levels, this will give me cues that there is some problem in his genitourinary system, as well as a signaling from the brain to this genitourinary system. Automatically, if that is affected, I will go and with a physical examination in my hand, let's say a low volume testes. If there is a low volume testes, definitely it means that there are low stem cells inside, low sperm production inside. Automatically, before seeing a semen analysis, I will be expecting there is an abnormality in the sperm parameters, and that might be the cause of his infertility. Right. So before judging the patient directly with the blood test and the scan, I will do compulsory a physical examination, the overall assessment in terms of his history, which is must, to come to a conclusion, so that the patient also knows that what problems he is suffering and to what extent I as a clinician will be able to recover it. Because it's not like that every case is recoverable. There is something called as recovery, damage control and no treatment. So I need to stratify the patients accordingly.
So when sperm parameters are abnormal, how do you assess whether the damage is reversible or it needs treatment, or how do we do that?
Okay, so what we'll do is, it's like when I see a patient, as I told you, a physical examination, his clinical history taking, I'll do a semen analysis. If a physical exam is abnormal, I will check for the varicocele on an ultrasound. I will do a hormonal evaluation as well. Once I get this triangle of investigation which I want, this will be my baseline treatment, baseline parameters which I will get into my hand. I will start treating all the 3 parameters to optimize it to the best of the ability towards as normal as possible. Once I get everything normal, I will repeat all the tests or whichever is abnormal after 3 months, because a sperm from a sperm as in stem cell to a sperm, complete sperm, take about 74 to 90 days. So I have to give treatment for 3 months. After 3 months I will be seeing all the reports which are abnormal, and based on that I will be able to tell how much percentage of improvement is there. And that in that improvement I will take a female factor. I will ask the gynecologist, how is your female factor doing? And then I will come to a common ground where the person exactly sits. I will tell from my end, 50% shareholder, he belongs to a natural pregnancy, he belongs to an IUI, he belongs to an IVF. The female as well, the gynecologist will tell me, and we will be coming to a common ground, getting the baby for the couple. Number 2, regarding the DNA integrity, nowadays there are lots of amazing tests which are available, which are, some are standardized, some are okay standardized, some are not that standardized, some are TDS, some are dependent upon laborious inter-observer variability, but there are some flow cytometric tests where we will be able to get how much percentage of DNA damage is there. Okay. Now I have the center where I am working, we have developed test where we will be know how is the sperm wall integrity as well, doing an the annexin 5 basically, which is an apoptotic marker, because the sperm has to survive inside the uterus, right, to wait for the egg as well to come and then knock the door and enter to make an embryo. So that capacity we are able to know by new test, and the sperm knocking capacity which we call as an acrosin test, where the acrosin is required for to come in contact with the egg, dissolve the egg wall and enter, the DNA has to enter. So that we are also doing it. We have also started something called as an isomo test, where the isomo is a protein which will activate the oocyte to start forming an embryo itself. Okay. So yes, these are the tests which are not, first of all, standardized. We are developing it because science is developing, and we need to develop with the world as well, and we want to know answers for many tests as well. So we are doing some research into the field of andrology as well, to make sure and give outcomes to couples and give answers to couples why, and answer to their pain points. Why us and why me?
Right.
That is the main concept of pushing this test, so research, so that we'll be able to answer and clear the pain points for the patients itself, and we'll be able to tell them where exactly the problem is lying, and we'll be able to solve it accordingly. Once to get a solution, we need to know where the problem is first. So we are trying to figure out problems as well.
So again, this question of age when it comes. So we see a lot of women, when we talk, they are worried a lot about their age, because as they age, egg quality drops. Similarly, for men, as they age, does there have an impact on their sperm quality, in their DNA stability, etc.?
Definitely. Men and women only have difference in the X and the Y chromosome. Rest the body is same.
Okay.
So how there is something called as concept of menopause in females, there is something called as concept of andropause in males.
Oh, okay.
Okay. So what are the symptoms of andropause? But before going to the symptoms regarding sperms, after the age of 40, there is always a 1% drop in the sperm parameters, which is physiological for a male. Okay, number one. Number two, after the age of 40 to 45, the DNA of the sperm starts becoming disintegrated, as in, let's say, the aneuploidy risk becomes high. Aneuploidy, it means there might be chances of DNA abnormality of the embryo because of the sperm factor. So there might be, let's say, Klinefelter syndrome, which I was telling, where there is an extra X chromosome becomes high. There is something called as achondroplasia. There are some kind of kidney disease. They become on a higher side because of the physiological decline as well as aneuploidy, as in the DNA disintegration. So yes, apart from that, there is a testosterone decline as well. How the hormones decline in female, men also faces a similar situation, where the testosterone, which should be around, let's say, around 300, starts declining to an extent which will give symptoms in terms of his overall sexual cycle, his libido, desire, his erections, his ejaculation, the volume of the orgasmal levels start coming down. These, apart from aging process, which can be diabetes hitting him, hypertension hitting him, any kind of metabolic stress, bioenvironmental stress which is happening, will cause these problems to even upgrade even further. So yes, there is something called as andropause, and we are treating andropause in a very actively way, and men of such groups also are coming to my clinics, and I am treating them well as well.
Okay, so how do we know that we are like a man is an andropause? Is there any symptom for that again?
So number one is his sexual cycle is affected.
Okay.
His desire or libido to participate in a sexual activity. Number two is his erection grades are super fluctuating, especially in the last 3 months or 6 months, where he is not able to perform. His ejaculate volume has come down. His orgasm intensity has come down. Apart from that, he feels tired always. His muscle quality has come down. His weight lifting capacity, which he used to do before, has come down. His energy levels, day to day activity energy levels definitely comes down. He becomes mentally irritable.
Okay.
These are the factors which there are some men who might develop softness of the breast as well, of the chest basically, which we call as man boobs, becomes more soft, looks more like a female rather than a male. So these are symptoms, signs and symptoms of andropause. And once a man feels that these are the symptoms which he is facing, definitely he can come and meet a urologist or an andrologist, and then a testosterone shot will be able to circumvent all these problems.
Okay, I think there's not much awareness about this, right?
Yes.
And like women now, gynecologists are telling that men are attaining menopause really early compared to how it was in previous generations. Is it same applicable to men also now?
One of the reason is our bioenvironmental stress or insults which we are facing. The food, the population which was consuming 50 years before as versus now is absolutely different. The water we are drinking now is chemical based.
Right.
The food which I am eating is chemical based. The ketchup, which was 80% tomato paste, is now 80% chemical.
Chemicals, yeah.
So automatically our body will respond accordingly. So how it responds accordingly, the most, let's say, the most weakest of the most weakest of the parameters gets affected first. And who is the weakest in the body? Sperms.
Okay.
So sperms get affected. So the overall impact happens in terms of his fertility, his sexual life, his overall energy levels. Initially, let's say our parents, they were ready to work on weekends as well.
Yeah.
We don't want to work weekends. We want to take rest.
Yeah.
You understand? That's the difference which we are facing, because of our environmental insults which we are taking, and our body is not able to sustain that amount of stress which we are taking up.
Right.
So yes, definitely we are having an evolution. At the same time, as compared to the previous generation, we are not evoluting.
Okay. But past we have seen that even like men of 55 plus 60, even they were able to
Have
become
children.
fathers and have children. So is that age also come down
Yes,
drastically?
definitely.
Okay.
Definitely.
Okay.
Now
So,
my clinics, the maximum, the age group which I am seeing for infertility is, let's say, from 25 to, let's say, 40.
okay.
And most proportionate median age is around 28 to 32,
Okay.
who are coming to my clinics with infertility problems.
Right. So if treated early, they definitely can get good results, right? But
Yes, treating first is getting evaluated
Eva-
early,
right.
because treatment all depends upon what kind of correctable factors they have. There are some boys coming to my clinic, let's say delayed puberty, where I get to know that they are having a Klinefelter syndrome. I will be keeping them on continuous follow up with me. And let's say there are 3 boys which are of Klinefelter syndrome. One had an ejaculate, who had a sperm in his ejaculate. I have frozen 3 vials for him.
Okay.
So I have kept a opportunity for that guy who is going to live a normal life to have his own DNA baby. There the other 2 guys, boys, I did a surgical sperm retrieval when they turned 21. And I have frozen 3 or 4 vials for them. I got for them. The other people where I have not got, I have explained them that there is no chance of getting sperms because you are not producing it. You don't have any stem cells left, and there are no treatments right now where we can activate whatever the quiescent stem cells are present in the testes. So there is no option for them as of now. The science has not developed for now, but others where I will be able to know where exactly to retrieve and keep, we are doing it.
Okay, but so early in age also, is that all possible? Because I think people are not aware, right? At 21 and 25, things
21
like this.
is not the age for the awareness. Yes.
Yes.
But yes, people slowly and steadily, how a CBC came into a picture, where now everyone is doing a child at 21 years old also is doing it because of, let's say, a yearly checkup. Same thing, over a period of years, a sexual health checkup also will come,
Right.
where yearly he is going to get himself checked to know how he is doing. Because nowadays, because of the internet wave, it was there before initially in the West as well. Now let's say a guy who is approaching a girl who is approaching a guy for a marriage itself, they are asking all these questions as well. What is your semen analysis? What is your HIV status? What is your hepatitis B status? Are you vaccinated? Are you not vaccinated? Apart from other questions of social circuits. So these health questions are coming into slowly into picture as well, and definitely yes, once that comes into a regular format among the population, especially in India, definitely from the 21 years of age, people will be doing tests by themselves to know.
Okay, so for people who are watching the podcast now, somebody is getting married, like a man, like for him to self-evaluate, what are the tests he has to take so that he knows he's perfectly fine, or he has to postpone his marriage a little to get himself treated well? So what is that they have to do?
Do not postpone marriage.
Okay. Okay.
Number 1. Number 2 is, as I told, doing just a semen analysis doesn't make you fertile versus infertile. It is all the probability between the male and the female partner. So getting a semen analysis done in a standard lab where a WHO 6th edition is followed, a couple of hormone tests, let's say a testosterone, and get a self-examination by a clinician to see how his testes volumes are or any abnormality is there, is more than sufficient.
Okay.
But it should be taken if there are any ups and downs in the semen parameters, should be taken not should be taken like a pinch of salt. You should not start breaking on head, oh, this is abnormal, I'm infertile. I need to disclose or not to cut this. Disclose we need not enter.
Okay.
Now, so if the semen parameters are super abnormal, let's say an azoospermia, a cryptozoospermia, this is a major problem and needs to be evaluated, and his sperm retrieval chances and everything he has to explain, to be explained by the clinician. But if a sperm is present, let's say in a borderline category or a pathological category or a normal category, it means their sperm is present. He needs to try naturally with the partner for 1 year before defining that male as fertile or infertile, because the WHO 6 criteria is based on the parameters from semen analysis of men from different continents of the world to come to a conclusion what is of, let's say, people getting pregnant within 1 year of unprotected intercourse. So there are some men who will be in pathological criteria but still having natural pregnancy, and there might be some patients in borderline criteria still having natural pregnancy. That doesn't label them as infertile.
Right.
Normal is absolutely okay, but these two categories where patient starts getting conscious, oh, there is some abnormality, should not make them feel that they are infertile. They have to try to know that they are having an infertility. Unless then there is no certain guarantee where we can label it, because let's say a female who is absolutely normal, a good egg, okay sperm, pregnancy is happening. Let's say female is suffering from, let's say, PCOS or low reserve. Statistically, overall as a couple, the chances of natural pregnancy comes down.
Yeah.
So here also there is no blame game on the male factor or the female factor. It is like the probability of those two combination which came via marriage apparently has not giving results in terms of natural pregnancy. So we have to just diagnose the problem and then give them solutions accordingly.